Yes. All right. What do we
On my
got?
screen, it says live on Facebook, Andrew.
Yay. Except for
Oh,
I'm not.
does it on mine too?
Freak. Multitasking.
Hey, Andrew, I'm sorry I missed the board meeting.
See how you are? All right, hang on. Got to get Joe Garcia in. Talk amongst yourselves.
Where you go, Jay?
It says live now. I see it.
Yeah.
What?
Where are you walking to?
To get to plug in upstairs so it doesn't lose all the.
Out there and they're hauling away that piece of shit man out. Yeah, I gave him a big little applause.
Well, I've been calling, reporting it.
Well, they're there now.
And the same thing with that other car on the other side of the driveway. It's been there for
I thank them immensely.
weeks without.
Hi,
moving.
everybody that's watching us live on Facebook.
There we go. Hello. So now I have to get back to my Zoom page. There we go. All right, chats.
Hey, Fred.
Good morning.
Hey, Mike. Good morning.
How you doing?
Good, you?
Great.
All right, so we have Joe Garcia should be adding shortly here. He didn't get the email. Got 5 more entering.
Hey, Mike, did we vote on the QuickBooks at the board meeting? Were you there?
I
Yes.
was there.
Are we good?
No,
Sure.
we said Bill doesn't get anything he wants.
Good. Then I don't have to do it. That would be my choice.
Happy birthday to Keith. Happy birthday to Keith.
Happy birthday,
dear
Keith.
Keith.
Happy birthday
to
Keith.
you.
All
How great
right.
is that? Thank you all.
Let's see.
Thank you,
Yeah.
Dr. Moyer.
There's Joe Garcia. All right, and it's 12:02. So, in the spirit of trying to keep things going, which I am challenged with today with this whole new. Oh, there's our speaker, Miss Baker.
And our speaker's here. Hey, Janice.
Yay!
Hi there.
So I will pick up my croquet mallet, and we will call. Whoops! Hang on one second. Admit Arlene and Irv, and here we go. Start our meeting today. So, where did we go? Joe, would you be willing to give us our invocation while I mute Jay because
Just because.
All right.
Unmute Joe, though.
yeah, sorry, Joe.
All right. Are we good now?
We're good.
We're good. All right. Father God, we thank you for this day. We woke up with life. We woke up excited with what the things that we must do, hearing good news. But there's also those things that are concerning, that are in the back of our heads. We want to put those before you today. As we meet here, we have wonderful fellowship and friends, and we laugh and we learn. We ask that we may be able to take that out into the community and with other friends that are not part of this wonderful family. And we ask you to continue to be with us today, to bless our speaker, and each one of us keep us healthy and moving forward always. We ask this. Amen.
Amen. Thank you. Sorry, one more thing I just realized I have to do. All right. Go back to share screen. Boy, this whole, I have to tell you, this whole Facebook Live thing has messed me up. All right. Ken Myers, would you do our Pledge of Allegiance for us, please?
I will, thank you. Everybody, if you'll put your hand over your heart and join me. I pledge allegiance
Allegiance to the flag
The
of
flag
the
of the
United
United States of America
and
and to the republic
for
which
which
it
It stands.
one
nation,
nation
under God,
God,
indivisible, with liberty and justice for all.
Excellent. Thank you all. Here we have your grand old flag by a bunch of kindergartners.
Yay.
Somehow they sound better than we do.
You're a grand old flag, you're a high-flying flag, and forever in peace may you wave. You're the emblem of the land I love, the home of the free and the brave. Every heart beats true under red, white, and blue, where there's never a boast or brag. Should all acquaintance be forgot, keep your eye on the grand old flag. You're a grand old flag, you're a high-flying flag, and forever in peace may you wave. You're the emblem of the land I love, the home of the free and the brave. Every heart beats true under red, white, and blue, where there's never a boast or brag. Should all acquaintance be forgot, keep your eye on the grand old flag.
Yay.
That was
What
awesome.
a great idea. Hey, Andrew, ask
Sir.
them to sing the Howdy song too.
Well, make the recording. All right. Welcome to our Zoom meeting. We have at least one guest, our speaker, Miss Janice Baker. Welcome. Do we have any other guests here today? Let's see here. Oh, there's a face I haven't seen in a while, Mr. Joe Stanford. I guess he doesn't quite qualify as a guest, though. And Chuck Ailing is back. Welcome.
Hi, Chuck.
Robert Resnicek is here today. So no guests. All right. Well, Janice, we still have a treat for you. We're glad to have
you here.
welcome. We sing loud and clear. Relax.
Enjoy the program.
And
And
Come back to see us again.
Where are the people from the kindergarten when we need them?
apparently they're in your band, Aussie. So Aussie, here's your task. As a sergeant in arms, I want you to do the Howdy song in the style of your Peruvian love songs.
oh, I like it.
Okay.
Okay.
Yeah.
So our upcoming calendar, tomorrow night, Haven House again. Next week, we have Laura Hunter, who's on the Citizens Council for Climate Action in the city of Escondido, to talk about our climate action plan. The following week, Deb Roth will be talking about who let the dogs out. Oh, no, sorry, work shift happens. Oh, September 1st is not the alcoholism one. I apologize. The calendar changed. I will have to change that one.
Right.
September 2nd is Haven House. September 8th is the next board meeting. And then the 8th and the 15th, we will have Tara Remmer Lawson and Kristen Gaspar. All right. Member moments. We actually do have a member moment, but I have it buried in Rotarians in the Wild, so I'm just going to leave it there because I didn't remember to move it. Does anyone else have a member moment today to share? All right, then on to Rotarians in the Wild. Here's Mr. Ken Manell raiding tomatoes from his neighbor's yard. He said he's making BLTs for everybody next week. He will have them shipped by Meals on Wheels to each of our houses. Stopped by the Arch the other day. A lot of names on the Arch.
Nice.
We have the Raymonds. We have our Rotary Club plaque there. I don't know if you see that right below Jack and Carolyn.
Yes.
Sulis family, they sound familiar. I think I've met them once. All-Star Signs. Oh no, that's a different Rotary Club. All right. And then all of our members who are members of the Escondido Community Foundation. That's really, really a very small print. So I will just say that there's a large number of our members on this plaque. Oh, Joe Garcia made the newspaper again. And thank you for bringing it to my attention last week so that we could find you this week. Joe, $75 for being on the newspaper and having your picture there too. I talked to Mike Freed. And then this was a member moment. Wendy Schaefer is a great aunt today or 3 days ago. So very sweet picture. Just reach out to Wendy and send her some love. Salvation Army, Ron, do you want to talk on this one or you want to talk on the next one about attendance?
Oh, I'd love to talk about this one. Thank you.
Okay.
So, we have our Salvation Army up there doing amazing work every day, taking care of people that, as they characterize it, are in the greatest need. And from time to time, they need a little bit of a leg up. They've come to us with a request for support for this diaper drive. The flyer pretty much sends it all. So what I'm hoping is that everybody that's at the meeting can find a way to print that. And if that's not possible, I can send it out later to everybody in a P-mail. Put it somewhere handy, and the next time you go by, next time, thank you, Bill. Next time you go by Costco or the local CVS or wherever it is you shop, happen upon a box of diapers in the sizes specified down the bottom left corner or the baby wipes, and just drop them off. Or I learned that if you actually order them from Amazon, Amazon will deliver them directly to the Salvation Army if you schedule delivery Monday through Friday, 9 to 4.
Nice.
So, hope you'll take advantage
I'm
of
going
that.
out after the meeting, Ron. I'll be glad to get some and drop it off today.
Great, thank you very much. And I hope a lot of people will pick on it. It's a wonderful project and they need the help. Thank you, Andrew.
Great.
My pleasure. And you might as well stay online.
Yes, sir.
Unless you want me to talk about the next one too.
Okay, we posted this last meeting, and this is just a second look at it for everybody and an encouragement for you. We'd like to see your name on this list when we do this again a year from now. And we're going to start counting attendance for this year's special or perfect attendance beginning the 1st of September. So, we'll figure out a fair way to take attendance at the Zoom meeting, and we'll rack up the count. And we'll also encourage you all to start logging in your makeups if you're not able to join the Escondido Zoom meeting. We're going to figure out how to get links to visiting or clubs to visit via Zoom other than ours. And if not, you can always go back to the recordings of the meetings that Andrew does and see our meetings after the fact, and then record your own makeup in the DACDB system. So I don't know if anybody has any questions, but just to let everybody know ahead of time that we will start counting attendance for the purposes of perfect attendance on September 1st.
And actually, this weekend, there is an opportunity for a makeup meeting. It's the membership seminar online. You can go to the Rotary5340.org site and sign up for it. It's free. And I know a lot of push has been for Red Badgers to go to these things, but you know, we haven't had a new member visit or a potential new member come to any of our Zoom meetings yet. So maybe that's a great way to get some ideas to reach out and find some new people.
Mhm.
So just pushing that for a second. Speaking of membership, our own our famous membership committee chair. He's going to take a couple moments to talk about the membership committee, service committee. He's the chair on our board, and talk to you just for 3 to 5 minutes about this.
Well, first I'll start out with the general state of Rotary membership. I couldn't get current statistics because my Rotary.org is offline till tomorrow.
Mm-hmm.
But for a number of years, worldwide Rotary membership has been 1.2 million people. It has been declining in the US and is offset by gains in Asia and South America. And looking at the people that we lose some to sunrise clubs, we lose some to after 5 clubs, and I'm sure lunchtime clubs are taking a beating like we are also with the e-clubs. So we need to think of ways to keep our club relevant, to attract new members and retain members that we have. And right now it's hard because we were not having meetings, really in-person meetings. We're not having that many projects out in the community where we can bond there. But I would certainly appreciate any comments you have as to how we can make our club more appealing and relevant to new and younger members. Okay, our committee, we have a number of positions there, or roles. Chair, co-chair, which we currently don't have. We need someone to do classifications for new members. We do background checks using public information only. So that I encourage you when you sponsor someone, know something about them, because we're not going to do, pay for criminal background checks. And if I can't find it online without paying, we won't know. So you're the first screen for new members. Our good friend Ron Smith touches so many parts of the membership process. I have a document in front of me that has 16 different steps from the initial proposal until the person is inducted. And everything goes through the executive secretary many times. I know this is I'm jumping all over. But you propose a member, we do the background check, sign a classification, goes to the board of directors for approval. The board, after that, then we get a member information sheet, which is more detailed information. Then we meet and talk about, sit down with the candidate, talk about Rotary, have what expectations are, what benefits, and then get a check and a membership card filled, which goes back to Ron Smith. And he publishes these people after 7 days with no negative input. They are officially a member, and we go about scheduling the induction. There's a lot of things there that we can use help with. We're a small committee. And one of the important things, after a member comes in, Johnny Watson is organizing people to do mentoring for the new members. If you don't get new members involved quickly, there's a good chance you'll lose them. So I appreciate Johnny stepping forward to handle that. Marilyn Lynch kind of monitors the progress of the Red Badgers, asking them to report to her when they've checked items off. And that's kind of a thankless task. And I'm sure Marilyn could use some assistance there, especially in following up with the people who aren't reporting. What am I missing? So we can always I can use a co-chair, because I'm getting a little tired of this and my foundation duties. Marilyn, I'm sure, could use assistance on monitoring the Red Badgers. And anybody that wants to be involved in the membership process can help me with the Rotary information meetings. And this is where we sit down with a bunch of paperwork, describe what our club's expectations are, get the money, and get the people in. So I don't want to take too much time. Any questions?
Brilliant. And again, as someone was just bringing up that we're not meeting a lot in person, here's an opportunity to maybe at least get together with one or two of your fellow Rotarians and help us bring in some higher quality people than me. Honestly, that's really the whole goal. of
What?
membership.
No.
I heard you were on Biden's short list.
Yeah. All right. Hey, there's buffalo in the home.
Hey,
Oh, give me a home where the buffalo roam. I think we have a fun song.
that's pretty close. You're going to mute everybody else, though.
I am. I'm going to mute everybody now, and you'll have to unmute yourself. Okay.
Hey,
Yeah, I'm unmuted, I think.
Hang on a second. Choop, there we
Ready?
go. I don't hear you, Jay. Jay?
Unmute. Okay. You ready?
I'm ready.
All right, here we go. If you want to feel good like a healthy person should, Janice Baker will tell us today. She'll talk about food that can help your mood, so don't worry about what you may weigh. Food, glorious food, with vitamins and nutrients galore. We'll tell you the amount so calories you won't count and which ones to buy at the store. If you have a large meal, it's not a big deal to leave some on your plate. You can bag it for home when your stomach may moan, as long as it isn't too late. Food, glorious food, with vitamins and minerals galore. We'll tell you the amount so calories you won't count and which ones to buy at the store.
Yay. Woo.
Okay.
Nice. So now I'm going to turn the whole thing over to Dr. Moyer to introduce Janice, and then Janice can give us her program. That's the word. That's the word, isn't it? Dr. Moyer.
President Andy and fellow Rotarians, it's a great pleasure to introduce our dynamic speaker today. Janice is one very busy woman. College education at Cal Poly San Luis Obispo, internship with Samaritan Hospital in Cincinnati, Ohio, postgraduate certifications in diabetic management and nutrition support. And since 1983, she's been in practice as a clinical and acute care dietitian, also as an assistant manager of nutrition services at Pomerado Hospital. In 1994, she joined Arch Medical Group, concentrating in nutrition and disease management and services. Is active in the eating disorder clinic, assists with home health, orthopedics, preoperative surgical education, is very busy volunteering with multiple organizations promoting diabetic prevention, education, and management, collaborates with many schools and universities, providing educational support to staff and faculty on health and nutrition issues. And if you get any of the Palomar Health mailings, you've seen her course offerings multiple times, and we're just thrilled to have you today, Janice. Thanks so much.
Thank you. I'm thrilled too. And I'm not done yet. So can you hear me okay? Am I coming
Yes.
through okay? Okay, very good. So I am so honored and very happy to be here with you today. My heart is in Escondido. I want to tell you that. So I'm thrilled, especially for that. My first job at Pomerado Hospital in 1983. I started right out of my training, and I learned so much from so many of the doctors I'm still working with and many other professionals. That was an amazing experience. As we know, the 80s were very different too. We went through a lot of different phases in the science of nutrition and how we apply it. And I'm so honored to still be able to do that. So yes, right now, my current position is with Arch Health Medical Group. I do outpatient nutrition services. At this point, it's all telehealth, of course, for the safety factor, but that's working out well. And we are bringing the classes that we used to do so much of, live classes, we're bringing them online. So if you're interested after our talk today for more, we are actually having the first class, Eating for a Healthy Heart, through Palomar Health, and that's on Thursday at 10 a.m. And that is something I could give you more information on later. So being that I'm a seasoned dietitian now, and during all this time, I also raised 3 kids. My husband, Mark, is an architect, as a longtime architect here in San Diego. And my kids are all in their 20s. I have 2 sons that are engineers and a daughter in Maui who's a veterinary technician and post-grad kinesiology student. So we've been through a lot, and certainly nutrition and nutrition science has evolved too. One thing I like to address, especially at this time, is a couple of things. First of all, we know that nutrition is vital to keep our bodies running right and to reduce risk of chronic disease. And one that keeps me very busy is diabetes. And as we know, diabetes can happen to people at any age and any size. We often are told, you know, if you are on the higher weight side, if you lose weight, it'll make diabetes go away. As we know, that's not always the case. Genetics, environment have a lot to do with it. Social determinants of health certainly have a lot to do with it. So there's many, many reasons why blood sugar is high, especially as time goes on with age. The other thing I'm working with a lot more than ever, it's coming to me a lot more, but I think also it's much more recognized, is eating disorders. That's a huge part of my practice, and it can happen to men and women at all ages. It's not just a teenage girl disease. And I'm actually seeing this pop up more and more in people over the age of 40, and for different reasons. And you can't tell if somebody has an eating disorder by how they look. It can happen to people also of all sizes. And it can be a consequence or a precursor to other severe, serious health conditions. So that's something I'm working with quite a bit and have had a lot of training on too. But generally speaking, we know that nutrition must be individualized to each person. In spite of all the fad diets out there, and again, 37 years of doing this, I've seen a lot of stuff. You know, if you look at any library shelf, there's books and books and books on all the diets we've seen. There was a time when fat was the villain. Now carbs are the villain. And there's always new things that people are restricting or adding or supplementing. And as we have seen very clearly in science, is that the more diets people are on, actually the worse health outcomes they have. So chronic dieting, restricting, and weight cycling actually does lead to more severe health outcomes. And I've seen that in practice over and over and over. So what are we getting at? What I try to encourage, first of all, is that there's no one perfect diet. It must be individualized. Everyone has their culture, their budget, their lifestyle that's individual, their taste preferences, their food preferences, and you know what is the goal of care? For example, one thing maybe some of you have experienced, my mother, who passed away a couple years ago, at the end of her life, what did she find joy in eating? Chicken nuggets and milkshakes. Was I going to push broccoli and salads on her? No, I would take her to McDonald's and we enjoy chicken nuggets and milkshakes together. And did she eat a lot? No, because 90-some-year-olds usually don't eat a whole lot at once. But it brought her joy. It brought her some fuel into her body that was hard to get into her otherwise. And that served a purpose. So to vilify foods, to say, don't eat this, that's bad, eat more of this, that's good, we're really missing the point here. Food is not just about nutrition. It's also about enjoyment. It has a lot of symbolism and emotion to it. And to deprive ourselves of the joy and the pleasure of eating is also wrong, and that is not nutrition. Would you agree with that? Any comments? Okay, so my job is, honestly, after all these years of, being very much in a lot of training on nutrition support, I work with critical care, I work with feeding tubes and TPN, which is IV nutrition when people's GI tracts aren't working, a lot of medical issues. I want to say, there's many, many aspects to nutrition. That is why you want to get your nutrition information from someone who has qualifications. Now, as I mentioned to my patients, that is why I hire a CPA to do my taxes. That is why I hire a plumber to fix my toilet. That's not in my lane. I'm sure many of you have talents and skills and backgrounds that I would love to take advantage of, so I don't screw things up or end up in jail. So when you're looking for accurate, credible nutrition information, that is my passion. That's what I do. I also don't have a conflict of interest. I don't sell anything. I don't push this or that. I make recommendations, but I'm also very, very conscious of budgets. I like to save people money because life is expensive. Having put 3 kids through college, I know exactly how that works. And I try to help make sure people feel like, feeding themselves and nourishing themselves does not have to be complicated. Any questions so far? So far, so good. I wanted to say that if you have questions after our talk today, I'm sure my contact information will be available. I am really happy to hear from you. You can email me, you can text me, however you want. I'll be happy to make my contact information available. But please do feel free to reach out. And it is my honor and my pleasure to help you find out what you'd like to know more about and what good resources are. So in the time we have, I'm going to bring up a few common recommendations I make to my patients. Many or most of my patients are in my age range. I'm 61. We're starting to develop issues with our heart, sometimes with blood sugar, sometimes with weight, sometimes with joint issues. I work with our orthopedic surgery team to help get people, in a better place for surgery, pre-op joint replacement surgery. I also work with people who are considering weight loss surgery, bariatric surgery, help them sort out those needs as well. So again, what I mentioned too is people are so confused. There's so much information. I heard about this. This book said this, I was told to eat nothing white. Don't eat anything white. That's a common thing. So I try to kind of what we call normalize nutrition. So a few things we know that are really kind of no-brainers, but are really very helpful. So first of all, we do know that our body and our brain need carbohydrates. Carbs are not evil. A sandwich has never sent anyone to my office. Don't be afraid of bread. Please don't be afraid of bread. It's one of the joys of life. So I have so many people coming into my office terrified of eating bread. It's pretty unbelievable. I never thought I'd be talking like this, but it's the truth. We need carbs distributed throughout the day. Of course, everyone's needs are different, to keep our muscles and our brains fueled. And in fact, I just got off the phone with one of my patients who is in his 60s, who's trying to get in better shape, and he's really gotten into bike riding. He was severely restricting his carbohydrates, and he was just telling me how awful he felt because he just hit the wall. He just couldn't do his bike rides. I recommended, let's up your carb intake, especially before the bike ride, in a reasonable amount. And the results were amazing. He could go farther, faster. He felt so much better. He didn't have so much fatigue after. So all this low carb, talk is often not helpful. And as we know, especially when we're dealing with weight issues and eating issues, when we have a lot of restriction, we actually overcompensate. You restrict, you binge. It's like a pendulum goes back and forth. I see that all the time. I don't eat during the day. I restrict. I eat a light lunch, just a salad. I don't eat much breakfast, but I can't control myself at night. I can't control myself. I have cravings. Cravings are a response to restriction. Anyone ever feel that? That's our body's way of trying to protect itself. That is normal and natural. Cravings are natural response to restriction. When we normalize food and neutralize food, it's amazing how much better it goes. And I hear this all the time when I bring this up and discuss this with my patient, normalizing eating. A couple of other things I like to bring up as we age. One of the big metabolic hits that has to do with nutrition in many ways is how important it is to maintain lean body mass. And that's the muscle tissue. I don't know if you can see my little 2-pound weight here, or my stretchy band, which I use all the time in my online visits. But what we see, and this gets more important as we get older, is that there is an accelerated rate of muscle wasting, especially upper body, because of disuse, because of aging. And again, that's accelerated as we age. It's very subtle, but the problem with that is muscle has many, many functions. It takes the stress off of our liver, it protects our bones, reduces risk of falls, all very, very important things. And as time goes on, it's harder to get the muscle back. That is called anabolic resistance. So one of the most important things we can do for ourselves as we age, especially, it's never too late, is to include, and I do every day, include weight training. This is 2 pounds. I'm up to 10 pounds now when I do my regular weight training. You can start wherever you're at. Stretchy bands, you can do this just while you're watching TV. It doesn't have to take a lot of time. Gyms are out of the picture now because of the obvious health reasons. But doing things every day like this can not only support your lean body mass, but also really helps with blood sugar management. Weight training stimulates glucose uptake on a whole different metabolic pathway than the medications do even. So it can complement other diabetes management therapies. And again, it's can be individualized. If people very often have other orthopedic type issues, physical therapists are wonderful helps with this. But strength training does get more important as we get older. Also in my work in the hospital setting and critical care, which I'm also still involved with, we are seeing that even a short stay in the hospital, you get a lot of muscle loss because of disuse, because of the stress and the systemic inflammatory response. And that muscle loss is all over the body. And that includes the diaphragm muscle that helps us breathe. So again, as we know, most of us will have something happen, right? Whether it's a hospital stay, an illness,
She works
an
for the
injury.
hospital. This is what she does for a living.
Yeah. So I always say, listen, it's never a bad idea to do the best you can to build up lean body mass. It's like having money in the bank, and it can give you more resilience, especially as we age. And as I mentioned, listen, I'm doing the strength training for my 80-year-old self because I still want to have good functional status, independence, mobility, reduce risk of fractures. And it's just a little bit that we can do that can make a big difference in the long run. So strength training, very, very important. People talk to me about weight a lot. And as I say, it's not just weight, it's state. Weight is just a pull of gravity. And you can have two people the same height and weight. I have a big problem with a BMI that way. BMI, body mass index, is really better for population health assessment. But as an individual assessment, you know, it's one metric, but it's not the whole thing. It does not measure body composition. You know, you have fluid balance, you have muscle, you have fat. So again, you could have two people the same height and weight with two completely different body compositions. So it's not just weight, it's state. And weight, we are so weight focused and there's so much weight stigma, and the number on the scale can make or break our day, can make us nuts. That added stress is often not worth it. So I help people put the weight part into context as well. That's very important. As I tell many of my patients who are really focused on losing weight, I say, you know, you can lose weight on cigarettes and vodka. I don't think that would end well. What's the point of that, right? And then again, you know, the rest of your life wouldn't be so great. So it's also malnutrition. Malnutrition can happen in any size body. And that's also something very under-recognized. I see people of all body sizes that are malnourished. And some of my larger patients have severe malnutrition because of erratic eating or chronic dieting. And they still have a lot of nutrition-related issues. So when I tell them, you know, you actually have malnutrition, they're almost relieved because somebody's actually listening to them and not judging them by number or their body size. And when we focus on correcting malnutrition, it's amazing how much better they do without feeling judged or shamed. Shame is not medicine. And we need to keep that in mind. So the other thing I'm going to talk about nutrition-wise, getting back to the food part, is the lovely opportunity we have with our gut. Fiber. So I have some fiber sources here. One is oatmeal, one is all bran. These are two different types of fibers generally. Fiber is considered what we call a prebiotic. We hear about probiotics a lot, the expensive stuff you find on the shelves, which isn't always worth it. But we do know that fiber-rich diets that come from whole grains, fruits and vegetables, there's no bad fruit, there's no bad vegetables unless you're allergic to them or they're spoiled, are full of fiber. Fiber is a very, very protective nutrient because it goes into our system, and within our gut, it's digested, fermented to, first of all, create something called short-chain fatty acids, which are fuel for the lining, the barrier of our intestinal tract, which is about 27 feet long, and the surface area is the size of a tennis court. And the fibers also feed the good, healthy bacteria. So it helps with our immune system. It helps with reducing the risk of certain chronic diseases. It can help lower blood sugar. It can certainly help with serum cholesterol levels, that's a whole nother complicated field. But we're finding that the soluble fibers, especially from fruits and veggies and oatmeal and beans specifically, can lock up the cholesterol in the gut and help bring it out. So fiber-rich diet, which is from carbs. You know, you only get these from carbs. Meat, cheese, and eggs don't have fiber in them, is very much associated with a dietary pattern that reduces the risk for several cancers, can help with blood sugar control, can help with blood lipid management, which brings me to another related issue, which we're seeing much more of, and that is your liver, fatty liver disease, really on the rise because it's very associated again with diabetes and excess weight, and also disuse of our muscles. And when I was in college a long time ago, in my advanced nutrition classes, our professor always said, if you don't know the answer to something on the test, write the liver. You'll get it right, probably, because the liver does a zillion things. And one of those things it does is cholesterol metabolism, but also glucose metabolism. It's very involved with that. Being that we are seeing a rise in fatty liver disease, which is progresses to inflammation, to fibrosis, to cirrhosis. It's a very silent until it's not. That is something I'm very obsessed with too. In fact, one of my favorite classes that I taught, while we were having live classes through Palomar was a class called Loving Your Liver. And that got so much attendance. It was one of my most popular classes. The liver is a big deal. It will always be a big deal. And all these things we're talking about, including the fiber-rich diet, protects your liver. There's something we talk about called the gut-liver axis. And there's a lot of crosstalk between your GI tract and your liver for many reasons. Same thing goes with your kidneys. I have a class called Caring for Your Kidneys. And this type of dietary pattern, it's not complicated, but emphasizing fruits, vegetables, fibers, healthful eating, joyful foods as well. There's room for fun foods. Also does help with better kidney function as well for many reasons. When I was a dietitian way back in the 80s, the idea of a diet for people with kidney disease is very different than it is now because we've learned a lot more about the bioavailability of certain things and the role of protein and other factors in kidney disease, which is also rising because we're checking it more. It's age related in many cases, but all these things do work together. The muscles, the fiber, the healthful eating patterns, making sure you're getting good sleep. One thing that I didn't mention that I mention all the time now to my patients, I don't know if there's any dentists here, but we are finding the role of good dental care is also essential in blood sugar management, cardiac disease, for sure, and overall systemic inflammation. The bacteria in the gums and teeth, or the bacteria in the gums, specifically periodontitis, gingivitis, goes directly into the bloodstream and in itself can cause insulin resistance, higher blood sugars, and inflammation. So again, this is not sexy. This is not exciting. Nothing I do is, but good dental care is highly associated with better health outcomes. So I do recommend discussing with your dentist, your dental hygienist, the best way to take care of your teeth, because that is associated with other health factors. So there's many, many things. It's not complicated. It's not exciting. But typically the things that work are not that exciting, right? It's not some flash in the pan thing. It's science and evidence-based. And that's kind of how I roll. It's actually to make people's lives more simple rather than more complicated. This is why, as opposed to what people might expect, I do not promote calorie counting, apps, weighing and measuring, number-centric eating. I think that sucks the joy out of life, and it really doesn't really last long. I see a lot of problems with that. So I approach my patients with a lot more what we call intuitive eating, normalizing eating, taking all the metrics out of it, really making sure people are savoring and enjoying their food and listening to their inner self. We're born knowing how to eat. We're born with our internal Wi-Fi that gives us the message when we're full, when we're hungry, when we're satisfied, just like babies know. And we can get that back. takes a little practice sometimes. But I think I have seen some amazing results using that approach. It's much more fun and it's much more sustainable. So I've talked about a lot of things in a little amount of time, but really one thing I would love to hear is if you have any questions. Anything?
Yeah. So we have about 8 to 10
Oh,
10 minutes
perfect.
for questions.
Perfect. I love that.
Yeah,
Christine, go ahead.
Go ahead.
Yeah, Christine and then Ken.
Yeah. Listening to your internal dialogue is always interesting because mine told me to go get an apple fritter yesterday and I did.
And I'm glad you did.
I'm glad I did too. I'm glad I didn't get a dozen. So that's my success.
Exactly.
What's your advice for those of us that are struggling with the quarantine 15?
Well, first of all, I love that. And that's been really brought up a lot. So this is a time, I can't remember any other time like this. And honestly, biologically, anytime, there is a threat to us, we are frightened, all of a sudden options are taken away. Psychologically, you go to bed thinking, okay, what's next day? What's tomorrow going to be? We're under this higher level of stress, which comes out in different ways. One of those is a hormonal change called cortisol. Cortisol, gets us ready for a threat. And part of, this fear response is sometimes we gain a little weight. If that's the worst thing that can happen during this, I'll take it, right? Now, it doesn't mean don't take care of yourself, eat 18 apple fritters at once, to, eat your feelings. Doesn't mean that. But really, again, part of this is just readjusting to this really new world we have. In some ways, we can discover new ways of doing things that are actually better than before. I know I have in some cases. Again, it's, readjusting to normalizing eating, making sure you have routines. Routines protect us from chaos. So getting good sleep, having time, space in your life for joy and movement, other alternatives, keeping connected. One thing I didn't talk about, which I often do, is not just what you eat, but how you eat. Eating behaviors. So one thing I ask all my patients about is, do you ever eat in front of TV? And if the answer is yes, that is like texting while driving, because eating in a distracted way, eating in front of TV, computers, or screens really corrupts your body's internet. We are born with signaling. That's called the gut-brain axis. And eating in front of screens really turns off your body's Wi-Fi. So if you're going to enjoy an apple fritter or whatever, I don't care what it is, honestly, you sit down and savor it and you notice how much you're enjoying it and notice when you're satisfied. Maybe there'll be part of it that you want to save for later. Maybe not. I don't know. There's no right or wrong, but it's really eating behaviors is what I'm also looking at too. So eating in a distracted way, eating while you're driving, eating in front of a screen, that can completely get in the way. So I really work with that quite a bit. Eating
So no more eating during meetings is what I'm hearing.
Well, if you're hungry and you really need to fuel your body and there's not a good option, for the most part, I say that. But there's always, listen, there's going to be things that happen that way.
Ken Myers.
Yeah, I just had a couple questions.
Sure.
You sort of advocate carbohydrate intake several times during the day. And that seems to have had its genesis in the 1970s and the 80s when you were trained. So you seem to be advocating that
it must be individualized, must be individualized. So this is very general. Everyone is different. So I really take things, everyone is completely unique.
Well, where I was going with it was, since the 70s and 80s and the 50 years we've had since then, we've had epidemics of obesity, diabetes,
for many reasons.
stroke, all sorts of things.
Yeah.
So that has not had a good result for the American population.
Yeah.
So how are you different in a way that is going to generate a different result?
Yeah.
Because just doing the same thing again, trying to get a different result is insane.
Right. That's why I look at each person in context, right? It's not just the bread. I look at other things like social determinants of health, their stress, their sleep. I ask about sleep all the time. When we have poor sleep, snoring, irregular sleep, people are on their phones and screens, you know, all the technology that we didn't have in the 70s. And they're on their screens and many, many other things. That could be a player in the game. So yes, while, you know, definitely different takes on ways of eating have changed, we need to look at the other determinants of health and how that plays into it. So that is why, listen, after 37 plus years of doing this, I'm never bored. Science constantly evolves, but it actually people's unique ways of doing things, and our culture has evolved greatly as well. How much we're driving, how much we're in front of screens versus then. I look at, you know, not just exercise, are they exercising every day? I look at movement throughout the day. And medications. So for example, medications people are on. When I started out, there was one pill for diabetes and a couple of different insulins that we don't even use anymore. We have a lot of other choices now for just blood sugar management. That has made a very big difference. But also what I see is, you know, it's not just the carbs, it's the chronic dieting, the up and down, the weight cycling. Actually, that is a detriment because people on and off diets, they lose the muscle, they regain the fat, they're psychologically and physiologically beaten up over time. And all the bariatric surgery, pre-op patients I see, and I work with that a lot, those are the ones that have been on the most diets. So I look at not just, oh, what are they eating at this point? Were they restricting, binging, or is there disordered eating in the picture? Is there other things, other traumatic events that are going on in their lives? Many, many determinants of health that I take into consideration. Yeah,
All
that's
right.
what keeps it interesting.
Perfect. Would you be available after I close the meeting out to answer more questions?
Absolutely.
All right.
I'm happy to. Yes.
Yay, fantastic. Thank you, everybody. I do want to close out the meeting so that I stay on track because I've already missed
Take
one
into
meeting
consideration.
too long.
Yeah,
But
that's what keeps it interesting.
perfect. Would you be available after I close the meeting out to answer more questions?
Absolutely.
All right.
I'm happy
I'm
to.
hearing
Yes.
Yay, fantastic. Thank you, everybody. I do want to close out the meeting so that
What the heck is going on? There's
I stay on track because I've already missed
Take
one
into
meeting
consideration.
too long. But
That's what keeps it interesting.
if people one day woke up and became happy, would you be available after I close the meeting out to answer more questions?
Absolutely.
All right.
I'm
So we
happy
close the
to.
meeting
Yes.
out? Yay, fantastic. Thank you, everybody. I do want to close out the meeting so that
what the heck is going on?
Thank you,
I stay
Janice.
on track because I've already missed one.
We just keep repeating.
Yeah, I'm gonna close. I'm gonna find this.
Bye.
It's on Facebook, isn't it? Why is it on Facebook?
You guys put it on Facebook.
Well, no, I know. I mean, no, but my Facebook isn't running on must be somebody else's computer was repeating the Facebook. All right.
Mike,
I'm going to keep my mouth shut now. Keep chatting.
It's funny you say keep chatting and we all shut up.
Right? Right? What happened there? Everyone wanted to talk. Jade, did you have something?
I mean, I can ask lots of questions. Okay, let me think. So as far as the carbs go, so not all carbs are created equal, right? I mean, like fiber-filled carbs are what you would want to go to, or what are your thoughts on that?
For the most part, of course they're not. Listen, jelly beans can save a life. If you have somebody with blood sugar that drops and goes low, you know, carbohydrates, simple sugars are life-saving therapy. You know, you need to get that quick, fast, get their blood sugar up so their brain works and we don't have a medical emergency. But yes, for the most part, carbs, you know, which come from fruits, vegetables, they not just have carbs, they have fiber, they have water, they have other nutrients that support our body. Those are what we want to have for the most part. But there are joyful carbs that have a place too. You know, when Disneyland was open, you'd go to Disneyland once in a while, not every day, you know, or you'd get sick of it and you'd hate it after a while. So if you include some joyful carbohydrates, you know, something delicious into your overall nutrition, it's wonderful too. It doesn't hurt anything unless you're allergic to it or unless you're eating the whole pie instead of a piece of pie and moving on. So yes, of course, they have different qualities and nutrients, and that's why we have a variety of healthful foods in our diet.
And can you talk about the importance of water and the water consumption as far as how much and all of that goes?
Yeah, well, of course, again.
Electrolyte management.
What's that?
And electrolyte management.
Yeah, okay. So good questions, both of them, because I've had to study hard about fluids and electrolyte management and acid base levels. That's always on my big exams. But water, very, very important, of course. We need water to make our bodies work. We're 70% or so water. And our water needs are also somewhat individualized. Listen, we get fluid from many sources. Fruits and vegetables are 90% water. So if you eat a high plant-based diet, you're getting some water that way. You get water from other fluids besides water, coffee, tea, other things. If you are sweating a lot, you have diarrhea, you have other medical issues, a fever, you're losing fluids, you know, more than usual. So there's things that affect our fluid needs, most definitely, but for the most part, in a healthy person, you know, you can tell how hydrated you are by the color of your urine. So we want it to look like pale lemonade versus apple juice. That's a marker. Now, as we age, especially in my senior patients, we tend to lose our sense of thirst. We don't recognize it. And that's why many older people, as time goes on, can get very dehydrated, and that can cause some mental status changes. So for the most part, I recommend to my patients just to make it easy. With each meal and snack, have a glass of water. Again, you know, coffee and tea does count. It's okay. What doesn't count? Alcohol. Sorry about that. I apologize, but not really. I don't apologize. That does not count as fluid. But yes, the color of your urine can make a difference. So, you know, again, you may need tons of water if you're working outside, if you have a very physical job, if you're sweating a lot, if you have a fever, if you have vomiting and diarrhea, you're going to get dehydrated quickly. My patients with diabetes who have very high blood sugar, they get dehydrated quickly because your kidneys will respond by making you want to pee all the time to get rid of that sugar. So patients with very high glucose levels can get dehydrated very quickly, and that can be a medical emergency. Electrolytes in our blood are tightly controlled by our kidneys. Our kidneys, when they're working well, they do a great job at that. So for the most part, we don't have to worry too much. If you have, again, GI issues, I have patients with lots of their gut taken out. They have short bowel syndrome. They have other pretty severe medical issues. They're on IV nutrition because their GI tract doesn't work, or they have kidney disease, for example, where their kidneys are not able to control appropriately levels of potassium. I do have to work with these patients to make sure that we are monitoring their electrolyte levels. And in the end stage kidney disease, we have to be careful about potassium and sodium and other things. Phosphorus is another electrolyte. In my patients with severe eating disorders. And I have very severe eating disorder patients who have a body mass index as low as 12. It's not that unusual. I have some very ill patients. They are at risk of what we call a refeeding syndrome. And that is when they haven't been eating well and we start to feed them too quickly. There's a lot of metabolic changes that can be disastrous with changes in their phosphorus and potassium and magnesium levels. So there are medical indications for really tightly monitoring electrolytes, but for the most part, our body knows exactly what to do and how to do it.
As long as you throw those resources into it.
Yeah. If you're eating normally, your body is really good at checks and balances. If you have normal kidney function, liver function, other GI function. And again, that's why, this goes to say you go to your doctor on a regular basis whenever it's recommended for physical screenings, keeping track of lab work for whatever reason that it may be needed. Some medications definitely can affect electrolyte levels. Your pharmacists are really, really great at monitoring that too. And they're very much part of this in the hospital setting is, of course. So there's many nuances to it. But when you get your labs, you talk to your doctor. If there's any chronic medical conditions, that is always typically part of what they're monitoring. Specifically, very important electrolytes such as potassium, sodium, magnesium, phosphorus, things like that. Your body does a great job for the most part of automatic transmission. Same with the pH level. We're often told, alkalinize your diet, change your diet, pH level. Your liver, your kidneys and your lungs do that automatically. That is also something. Talk to any pulmonologist or nephrologist, kidney doctor. Your kidneys and your lungs are very intricately involved in controlling very tight pH level. Drinking alkaline water will not do that. There's a lot of changes in your pH in different parts of your body. It's different for very good reasons. So that's something to keep in mind as well.
So what's the source of getting the best diet information generally? If we just want to go to a resource and find out.
Look at the degrees behind me. Look at all those degrees.
So how do we get to you?
You call me or you email me and you can set up an appointment. I do telehealth. I'm at Arch Health Medical Group. I do a ton of individual medical nutrition therapy consultations. And I've been doing this 37 years. And I see patients from all over San Diego. So I do this through Arch and I do this privately as well. I have many private patients.
What's the best way to get you?
I work all the time because my kids are all out of the house and college educated, and I love it. And this is my fun. So you can call me or text me. My number is 619-742-0145, and we can get you more information.
Thank you.
Are your services covered by third-party payers?
In many cases, yes. So insurance will cover my services with a physician referral and with a diagnosis. Again, you want to double check, every insurance is different, obviously, whether you have an HMO, a PPO, what your diagnosis is. Medicare, for example, will cover my services if you have a diagnosis of chronic kidney disease and or diabetes. That is what they cover for. If you have an HMO and your doctor makes a referral, it can cover for other conditions too. So I always say check with your insurance and your physician office to see, about that, because again, HMO, PPO, there's different ways it's done.
Thank you.
Yeah. Anyone else?
Well, just one last question. I know it's Dr. Jay Baker.
I'm
but-
not a doctor, but I play one on TV.
Okay, well, so when we talk to our internal medicine doctor and we say, we like what we heard from her.
Yeah.
We're in really good health, but we just need a little more energy.
Yeah.
So what do we tell him in terms of getting referred to you?
Yeah, just say, I'd like a referral to the registered dietitian, Janice Baker, just because I've been around for a long, long time right here in Escondido, North County, San Diego. Most know who I am. It's just, you know, the benefit of sticking around since the early 80s. You know, like a bad rash, right? So, yeah, you can ask for referral to registered dietitian, and you know, it works out pretty well that way.
Good, thank you.
Yeah.
How about calcium metabolism, the requirements for adults?
Yeah, that is very interesting. So calcium metabolism, like other electrolytes, it's much more than meets the eye. There's a lot of influences on that. So calcium in the blood, serum calcium levels, is not always reflective of our dietary intake. Calcium levels that are out of range can be associated with other medical issues. For example, in cancer, serum calcium levels can be elevated because of bone issues, bone metastasis. I've worked in oncology and I still work in oncology for a while. So there can be calcium that's high in the blood that has nothing to do with, you know, your diet. Low calcium can also have to do with other things like parathyroid gland, kidney issues. There's many nuances to that. For bones and bone protection, for the most part, that's also very involved. Bone metabolism is many moving parts to that. And it's often a specialist like an endocrinologist, you know, interestingly enough, that does a lot of work in things like osteoporosis, osteopenia, and bone metabolism. So serum calcium levels are typically kept pretty well, tightly controlled by your body, but if they're out of range, there's more to the story. So that is why all these labs, all the labs, are looked at in context of medical diagnoses, other labs, medications, other things that are going on. There's many influences on all the electrolytes. So that's why we have to pull back, zoom out with a wide angle lens. And instead of just looking at one electrolyte, we have to look at how everything is. Like, imagine an amazing concert. You don't just listen to that one violin. It's all those instruments together that create that amazing sound. That is how things work with your body.
Good.
Yeah. Good question. You guys are testing.
Well, I was interested in the phosphoric acid in diet drinks.
Yeah. Oh, I'm
washing out calcium.
Well, see, that's a very good point. In my kidney patients, which I work a lot with that. In my kidney patients, now we are really looking at the sources of phosphorus. And in patients who may have impaired kidney function, they may overabsorb what we call inorganic phosphorus, which is additives, phosphorus additives. So I talked to my kidney patients about that. And elevated phosphorus levels in the blood, because your kidneys can't get rid of it, can cause a very serious issue. It's called calciphylaxis. And that means that high phosphorus levels form a complex with calcium and can cause hardening of soft tissues. That's very dangerous. That can be our vessels and other things. Kidney doctors know this well. And that is why patients with kidney disease often take something called phosphorus binders with their meal, if that's an issue. So phosphoric additives are very highly bioavailable. That means they're absorbed very well. If you're getting what we call organic phosphorus, which means naturally occurring phosphorus in other foods, it's it's not very readily absorbed. It's a different thing. But yeah, phosphorus levels are a concern if people have chronic kidney disease. So we do want to watch out for that. In our patients who are on IV nutrition, they don't have a functioning GI tract. We have to carefully monitor calcium and phosphorus in their IV nutrition solutions, because that can be dangerous. If they're not perfectly matched, they can cause clots in the lungs. That's another bad problem. In our severely undernourished patients, as I mentioned, we have something called refeeding syndrome. If you start to feed people right away, the insulin that's produced all of a sudden can move phosphorus very quickly from outside of the cells to inside of the cells, cause something called hypophosphatemia, and that can cause cardiac arrest and respiratory arrest. Phosphorus is a very important mineral in all kinds of functions because it's part of what we call ATP, which is the energy source. And so phosphorus metabolism, it's fascinating. There's many influences to it. And especially in nutrition support, in people with severe anorexia or under malnutrition and kidney disease, we really look at that very, very closely. So it's fascinating, but it's complicated.
You did a great job of defining yourself as a super specialist,
well,
because people that speak about nutrition really don't get the handle of the whole thing.
You know, this is, that's why I have all these degrees behind me, and they're all earned. I didn't mail order these things. And it takes a lot of work to pass these exams and to maintain my continuing education, which is I'm never done. And it is more complicated, but because of brilliant marketing and Instagram and social media, people make themselves to be experts because of brilliant marketing, and they're very convincing, and they have a lot of junk to sell you, which is most of the time fraud and scam. And I'm going to be totally out front about that. Most of the time, people selling stuff in the area of nutrition, it's scam and fraud and scam and fraud. It's repackaged over and over. And I see so much of that, and it's shameful, and the ethics are very, very awful. So I am not shy about saying this because it's a mess, and I've seen this within the medical community, outside of it. And I've seen the collateral damage that it does, which is horrible. But people are feeling like it's their fault because they're victims of these scams. It's a mess. So I'm going to call it out. I don't care. Been doing this a long time. I can take it.
Good.
I've grown a spine finally after all these years. It took a while.
I appreciate it.
Yeah. Any other questions?
Janice, thank you so very much. It was an amazing program.
Oh,
wonderful. Thank
you guys are fun.
For talking so bluntly and not packaged. It was really nice.
I can't do it any other way. You know, I just can't. It's not me. I need to be authentic, or I'm not going to do it.
There you go. All right, folks. I think I'm going to go ahead and shut down the program.
Okay.
Thank you all for coming.
Thank you.
And for your questions and engagement, Janice. And I hope you all have a Merry Christmas.
No, that's still the way to go.
That's what Joe Byer would say.
Right.
It's just around the corner.
I've always seen the decorations come out.
Right.
Some never come down.
All right, folks. You have a great week.
Thank you.
We will see you
Thank
all
you.
next
Great
week. for
program.
sure.
Bye-bye. It was great.
Take care.
Bye.